Welcome to the Byja radio show. I'm your host, Dr. Byron Jasper, and we are recording live from J. Kinba Executive Suites in Baton Rouge, Louisiana, with special production by Becnel Media. Coming in like we never left, your favorite co-hosts, cousins, brothers, uncles, whatever you want to call us. We know we in your top 2, if not definitely your top 3. See what I did there?
Top 3.
See what I did there?
Top 3.
So based off of what I'm hearing, I'm just going to start off by just saying welcome. You made it to another week. You're here with us. Could have been anywhere in the world, but definitely listening into Byja Radio with myself, Dr. Jasper, and the amazing, the magnificent, the world-renowned co-host with the most, Mr. George Becnel, a.k.a. Patient Zero. How are you feeling, my brother?
Man, I'm feeling pretty good, brother. Look, normally I would slip you a $20 to say those things about me, but this week is only 10. Them tariffs getting to me, bro. Like, so I can only give you $10 to talk nice about me.
You go give me 10 and I'm gonna run it up to a higher amount because I got to tax other people that I got to pass it on to, is what I'm hearing. So
that's exactly what you're doing.
So we're gonna talk about the topic that I think a lot of people are hearing about, seeing, and if not, feeling one way or another, and that's tariffs, right? The word that is the probably word of the year, and we're only in April,
right?
Is the word tariff, and we won't sit and spend a ton of time on what is a tariff, because I think you can easily do that by doing an internet search or hopping on artificial intelligence, throwing that word in and asking that search engine or whatever to explain it to you. What we're going to do is do what we do best. We're going to talk about how that relates to healthcare, and how this impacts the everyday person from a healthcare sense. So my good co-host has an idea of what we're going to talk about today. What ends up happening we're going to pull the curtain back a little bit for our dedicated listeners. So when we have a show recording, the one and only Patient Zero comes in and he has some very good questions. He asks, what are we talking about? And then he also starts asking me questions based on the things that I looked up. And those questions actually helped me figure out what we should talk about. So one of the things that he asked was, well, if we're going to talk about tariffs, let's talk about who, what, when, and where, which is not something I was thinking about. I'm thinking about, hey, let's just talk about the stuff with America.
Sure.
But George said very clearly we need to kind of set the scene on where the tariffs are as of today. So George, I think you got the list in front of you from your deep dive. Can you tell us what countries that we are potentially getting goods from? And it'll make sense in a second. We're going to bring it full circle, but I want George to set the scene. What countries we're looking at that we are possibly getting goods from, and what those tariffs may look like at those actual country levels globally. Can you do that for us?
Yeah, I'll do that for you. And also, like to your point, we won't belabor the tariff and what it is and how detailed we go. But I think it is important to remind people that the country that the tariff is on doesn't pay it. The business that imports the good pays it. So when you have the businesses that pays it, that payment, that charge normally gets passed on to you, the customer.
Correct.
Because of economics.
Correct.
Right? But we're not going to go too deep in that, but I thought that was a very important point that you need to understand. So companies that are importing goods from Canada are getting a tariff rate of 25%.
Okay.
Mexico, 25%. India, 26%. Vietnam, 46%. And China, I have no idea why we're just like mad at China or like we're just poking the bear at China. But China has a tariff rate of 145%.
Okay. So if I'm hearing correctly, we're ranging anywhere from 25 on the low end for the countries we're talking about, and highest at 145%. So I think the second question that came up when we were kind of talking about this was, what are tariffs going to do in relation to healthcare? So people may not think about this because most people don't really think where these supplies come from. They just use them, right?
Correct.
So let's talk about what supplies could be impacted by these tariffs, because not only are they coming potentially from outside countries, what things are potentially considered medical supplies coming from these countries. So George, you got a list in front of you. Why don't you read off some of the things that could be considered, hey, this is a medical supply, it may come from another country, and I never even thought about that.
Yep. So when you think about a wheelchair, thinking about blood pressure monitors. Think about APIs, which is drug ingredients, and you think about syringes, all medical equipment. Those things come from China.
Yeah, absolutely.
Yeah, that's so if you find yourself needing a wheelchair, that price is going to go up exponentially.
Correct.
Vietnam supplies us with gauze, gloves, bandages, pill bottles. Those things all are relevant. And think about how many of these items you have in your house. I don't know anybody's house that doesn't have Band-Aids, pill bottles. You may have a syringe. You should have a blood pressure cuff, right? Think about those things. We also get syringe needles from India. We get generic medications from India as well. Mexico, medical parts, transport equipment. Canada, diagnostic tools, aluminum components.
And that's just a small list.
Very small list.
And I think that idea of these are medical parts or medical components or medical supplies or things that we're using, no one seems to think, oh, well, this is going to be a big deal. I'm thinking about it when I go and buy an iPhone, or I think about it when I go and buy a computer, or maybe I'm thinking about it when I go and buy a vehicle. But let's talk about very basic things. When you go get your medicine from the pharmacy.
Correct.
That pill bottle that used to be fill in the blank is now going to be higher.
Yeah.
So that is an added cost.
And your insurance is not going to eat the cost.
We didn't even get to insurance yet.
But
you already know. You already know we're going to go there. But the pill bottle itself, the cap on the pill bottle, the medicine in the bottle, those are all going to get more expensive based on these policies.
Yep.
On top of that, the wheelchair that you're in, the crutches you're using, the cast and the casting material that they put on you if you break a bone, the splint you put on your wrist if you sprain it, all of those things are going to go up. And those things are basic medical things that aren't complex, right? We're not even talking about surgical equipment yet. We're not even talking about things that are in hospitals like protective equipment, the PPE as we call it. We're talking about basic stuff, as you put very eloquently. Think about all this stuff that's in your house.
Yeah.
Right? These are things that you pretty much may not say, well, I buy this all the time, but you probably do, and you don't even think about it.
Right.
So when you go and buy that box of bandages or gauze
or that bottle of Advil
or alcohol wipes,
right,
all of those things are going to go up, and that's going to in fact affect your bottom line. And your bottom line is going to go up because the people who are potentially making the stuff aren't paying the tariff. It's the company that imports it. So when that company imports it and it costs more, they're going to pass the cost on to you. Mm-hmm. And that's not just big companies. These are smaller companies, whether it's a pharmacy, whether it's a hospital, whether it's a durable medical equipment supplier, we call it DME. Yeah. All of those things are going to now come down the pipeline, and those people are going to have to find a way to either stay in business or eat the cost. And most people are not going to eat the cost. Most people are going to have to pass that on for them to keep their doors open.
Yep.
So I want to hear your thoughts, Patient Zero. I mean, you're in this on a regular basis, sitting in this seat, having people listen to you and take the advice. I want to hear your thoughts on that. Is that something that you said, you know what, when I heard the word tariff, I automatically thought of healthcare? Or when you heard it, I already thought that this was going to be something that affects people on a healthcare level? Or was that something that kind of was there but not at the forefront?
It was there but not at the forefront.
I think so, right? Most people, right?
Because think about it. So, one of my favorite subjects that I've taken was economics. So I heard the word tariff, and I heard all these things that we're doing, and I just immediately went off in the deep end. Mostly in tech, right? When you think about like the phones and the computers, you think about the chips, the processors that are in everything that we even use in your cars. I thought about the automobile industry. I thought about how like Toyota passed GM as the biggest, car manufacturer out there, and now there'd be tariffs on Toyotas and Nissans and Hondas and all these good things, and those prices are going to go up.
Correct.
So I was thinking about all kinds of stuff, and healthcare didn't really come to my mind till later because number one, I spend most of my money that I spend on healthcare goes to you. Mm-hmm. So that's a service.
You're welcome.
You're an American. I appreciate it, and I'm glad there's no tariff on that because you're an American.
There you go.
But to your point, all this equipment. I got blood work today. I saw, a syringe. I saw gauze. I saw gauze tape.
Talk to him.
I had to urinate in the cup. All these things are on this list.
Yes.
So that fee that I had to pay to get my blood work done and my testing done, that's going to go up too.
Absolutely.
Absolutely. And it's one of those things where, until this settles, it's going to be rising costs for almost everything that you do.
Yeah.
All your services, everything.
Everything. And I think people are thinking like, oh, well, if it's a service, then it's not going to really go up in cost. No. You need to get that out your head today.
No.
Because as you are listening to this, those costs are going to rise as things trickle down. As
Right.
George just said, every supply that potentially is impacted will drive up cost, because if it costs the company more to order cups, it's going to literally cut into them being able to provide a service.
Yeah.
And if they can't provide the service at the same rate because they now have to pay more for their cups, they're going to have to raise the price. So that price of service will probably go up, because they can't say, well, I'm going to raise the price on the cup I'm giving you for it to collect urine, or on the syringe that I'm using to collect your blood. I mean, they could say that, but more than likely, they're just going to raise the price on the lab itself.
Well, absolutely, 1,000% they're raising the price on the lab. And what you have to realize, this is a bad situation. And when I say a bad situation, the best case scenario with these tariffs is everybody raises their price and passes that price on to the customer. Mm-hmm. That is the best case scenario.
Okay.
Let's not talk about if some of these costs put some of these other people out of business and there's less competition, and all of a sudden you moving that economic curve, you're driving up the demand, you're driving up the price.
Yes.
So it could get worse than the tariffs.
Correct.
You know what I mean? Just by cause and effect.
Correct.
So there's a lot of things that may go up a lot more than what you think. Mm-hmm. Like back to the car example, you think the price is only going to go up on foreign cars? Mm-hmm. You don't think the demand for American-made cars and used cars that's already over here is going to go up, and the prices of those are going to go up too?
Yeah, absolutely.
As medical equipment is going to be no different.
Yeah.
If
there's only one or two medical suppliers, when there were 50 in the past, you had 50 different price points.
Right.
Now you only got two. So you got to pick one of the two, and if one of the two are higher than what the other 48 were, your price goes up. So I get what you're saying, man.
Yeah, that could totally happen. Let's say I go to the store right now. I go to Walmart. I ain't going to Target. We mad at Target.
Smart man.
So let's say I go to Walmart.
Wait. I got to say this. Some of us who've been holding strong, they know who they are. Who have not been holding strong, do better. That's all I'm saying.
Man, hey, it's hot in Louisiana. We all need a little shade. It's cool. But anyway, like example, I buy ibuprofen. I said Advil. I don't really buy Advil. I buy Equate ibuprofen. It's the same thing.
Same thing.
However, what if I don't know, Equate falls behind, and then I got to go buy Advil at a higher rate now because they survived and Equate didn't.
Correct.
Now I'm almost paying twice as much for ibuprofen.
Correct. When it should be a discount, if not a fraction. So you cooking, man. I really agree, to the point where people don't think that far ahead. They think as far as their eyes can see, and they're not looking for lack of a better term, forest for the trees, right? Yeah, they're literally looking at that tree, and that's all they see, and that's all that matters. And then the rest of the forest is burning down,
right? And
they're over here thinking, well, everything's great because my tree is fine, until it's not.
It's not going to be.
It's not going to be fine.
So, and it's going to take some time. Like if you looked at the stock market as of late. That should be your indicator that we're in trouble. Now, I'm not all doom and gloom. Mm-hmm. I'm not saying we're going into a depression. I'm not saying that. Mm-hmm. However, it's going to get worse before it gets better.
As some of my people would say, if it looks like a duck, it quacks like a duck. It might be a duck. It might be a duck. So maybe. I think at this point, we are literally in a very interesting time. But more importantly, the cost that we are talking about is astronomical if you don't see things change and change pretty quickly. So I'm going to be as specific as possible. So I have a list, and I put the list together, and I want patient zero to tell me his thoughts on where we might be in terms of pricing with some of these items, and they're medically related.
Sure.
Okay. So patient zero, a box of syringes usually come in 100. Okay. The estimated price right about before all tariffs and everything happen, you're looking at about $10 to $20. Okay. So how much do you think that same box of syringes may cost once tariffs have potentially been applied? Now, considering we're different countries, you're ordering from different places, we're looking for a range, right? So between $10 to $20 gives you a decent amount of a foundation. Where do you think that same box could be?
So ideally, you hit 25%, right? You know, because the syringes come from India, which is 26%.
Yeah.
So on a $10 box of syringes, you would assume that the tariff would bring it up to another $2.60 or $5.20 on the $20 box. So you add that, right? And that'd be the simple answer.
Yeah.
However,
as you just mentioned.
However, there's a domino effect.
Correct.
You just can't add that. What if the, you know, some of these shipping companies like the UPSs and the FedExes and all these people are dealing with tariffs from some of their shipping products. You know, that price is getting passed to you too.
Correct.
So these boxes of syringes might go up from $10 to $15. It might go up from $20 to $30. You know, just because you hear that percentage,
right? It's only this percent.
It's a part of it because now I don't know if compounding tariffs is a word, but
it should
or is a term.
It should be.
It should be.
Yep.
I mean, but that's essentially what will happen because you know now you're paying multiple tariffs on the same product because of the domino effect. So
right.
you know, so you look at a box of syringes that could go up almost 50%. Same thing with needles, right? Same thing with gauze pads. But think about the blood pressure monitor that we say we get from China. You know, everybody should have a blood pressure monitor.
Yep.
You know, that blood pressure machine, that's $30. At 145%, that $30 goes to at least $75.
Easy.
And that's just with a flat tariff.
Yep. Not shipping, not whether the insurance is somehow involved because, hey, my insurance should cover that and I'll make it easier because blood pressure monitors or blood pressure cuffs, people don't tend to use insurance for that. But let's do one that's easier. Let's say it's a glucose monitor for diabetics that check their sugar.
Yeah.
Most insurances, if I remember correctly, will cover a patient getting a glucose monitor if they're a diabetic to where the patient doesn't really pay for it. Okay. But then the supplies that go with the monitor, also known as a test strip or a sensor or a lancet if you got to stick your finger, all of those things are medical supplies. And those are they're imported and they're also usually covered by the insurance. Now, you just hit the one, and that's the part that I say we're going to circle back to. If we're doing tariff by the supply itself and you're paying out of pocket, you may come out better. But if your insurance is now involved, okay, because insurance is now saying, hey, it was $30, but it's been marked up to $75. Now we got to pass that cost around to everybody to be able to cover more people.
Yeah.
So what do you think is going to happen to your insurance?
They're going to cover it.
They're going to cover
at 100%.
At 100%.
But that premium
just skyrocketed.
So
now you are paying.
Because think about this. Not only are they absorbing more costs, but what insurance likes to do, what a lot of people does, I don't know what every insurance company does, but what a lot of insurance company does, they take your money and put it in the stock market and grow your money and pay for things as needed. Well, guess what? If the stock market ain't stocking like it's been, and you can't grow that money, now they're losing money as well. What do you think is going to happen? The premiums are really going to shoot up. I'm telling you.
I'd just like to take a moment to add another phrase to the patient zero list of phrases. He has so many, but this is the first time in my life, and I'm over here almost in tears. I've never heard if the stock market ain't stocking. I've never heard that before. That's by far one of the funniest things.
I mean, I'm just being real. that S&P ain't growing like it's been, man. You know,
I guarantee if people who are really in the stocks start saying if the stock market ain't stocking, or if I hear any other news outlet, other media outlet use that phrase, if you don't come back and give us credit, or let alone us, patient zero, just that is gold. That is a golden phrase. If the stock market ain't stocking, right? You know what it makes me think of? The math ain't mathing. That's the exact same thing. But I've never thought about that.
It just came out. Maybe we need to make some merch.
That's what I'm saying. I feel like we should have T-shirts and hats that say the stock market ain't stocking. And at this point, maybe we can. Well, no, I was going to say the tariffs got it. So at this point, that hat just cost $78.
Right. That T-shirt from Shein, that might have been $15. Now that same T-shirt, about $45.
Strong 45, $48.50 if you put some taxes on it, which is a whole nother conversation depending on what state you're in.
Man, look, man, you can pay $50 for a T-shirt, man. You think you at least get a polo T-shirt, not a Shein T-shirt, you know.
Well, at this point, that goes into the next part that we're going to talk about. So we're going to give a concrete example on exactly what the tariff could be for something as specific as a durable medical equipment, piece of durable medical equipment. But we'll do that once we come back from this commercial.
Hi, it's Patient Zero from the Byja Radio Show. Are you tired of the broken healthcare system? Frustrated by long waits, rushed visits, and sky-high costs? Yeah, I was too. So if you're tired of dealing with any of those things, then I highly suggest you check out the book Byja Blueprint, an introductory guide to direct primary care written by our own Dr. Byron Jasper. It breaks down all you need to know about direct primary care, a model that makes healthcare simple, affordable, and personal again. The book covers topics like how DPC differs from traditional insurance-based care, what's the difference between direct primary care and concierge medicine, how employers can use DPC to cut healthcare costs, how this model reduces burnout and improves work-life balance for physicians, and so much more. Whether you're a patient like me, a doctor fed up with burnout, or a business owner tired of rising healthcare costs, this book lays it all out in plain English. If you're ready for something better, check out Byja Blueprint, available in paperback, audio, and ebook format. Visit bookstoread.com/Byja Blueprint DPC and get your copy today.
All right, and we are back. So I think the next part that is going to help drive the point home that we have really and truthfully talked about in the first part of the show is a concrete example of what it means that these numbers are going to go up. So George, I'm going to throw out a few ideas to you, and I'm pretty sure you're good at math and you're going to help the listener kind of hone in on this. So we're going to talk about, as I mentioned, a piece of durable medical equipment. So we're specifically talking about a wheelchair.
Sure.
I think that's easy for people to wrap their head around because it's a single thing, and that single thing can be very easy to say, hey, I know someone who's either been in a wheelchair or a family member's in a wheelchair, and I know that there's probably a cost to that actual medical device, right? Most of the time, the insurance may not pay for it, or if they do, they pay a portion of it. But for the sake of the argument, we're going to say the wheelchair average estimated cost when you're talking about getting a wheelchair and the insurance is not involved. Let's say it's easy number, $500. Okay. $500 wheelchair. Now, some people may say that's an expensive wheelchair. Some people may say, no, that's actually an inexpensive one. Obviously, we're talking about a regular run-of-the-mill wheelchair. We're not talking about motorized. We're not doing anything fancy. This is a standard wheelchair. Okay. So let's imagine that most wheelchairs come from China.
All right.
As of the beginning of the show, you said that the imported tariff on China is 145%.
145%.
145%. As of the recording, right now, this could change, but as of recording, 145%. So how much, in your estimation, does that 145% and 45% tariff mark up that wheelchair? Where is the price point of the wheelchair with the tariff added on?
Well, if we're only considering the tariff as specific to China, then that cost is going 145% of $500 is $725. So 500 plus 725 is 1225.
Okay.
Assuming that's all that happens.
And I want you to say it as clear as day to the listener that the $500 wheelchair new price would be what? Just tariff alone.
$1,225.
Okay.
$1,225
for a regular wheelchair.
Right. That was $500.
That was $500.
And that's best case scenario.
And that's best case scenario. And this is the part that I don't think people understand. This is assuming that the $500 is the starting price.
Right.
Now, maybe in your neck of the woods, the wheelchair may not be that much. Maybe it is $50. I don't know too many people that or too many places that have a $50 wheelchair. In some neck of the woods, $500 would be a blessing. So imagine if it was $1,000, right? At this point, most people don't realize how much stuff costs in healthcare because they are often doing what? Using insurance for everything.
Right.
So when you're using insurance, you have no idea how much it costs.
Correct.
That $500 that I just quoted to you may be really good because you thought it was normally $1,700. Because when you look at your explanation of benefits, we call it an EOB, the document that comes from the actual insurance provider, they tell you how much they think something costs,
right,
or how much they believe it costs, or how much they're marking it up. And they give you a number and you think that's the real number. That wheelchair may not really cost that much, but the price they're giving you is their price, and it could be $1,700. So my point is, best case scenario, if we're at $500 to start and we get to $1,225, you're actually doing pretty good considering if you started out at $1,700.
Man, look, you start at $1,700. That wheelchair is going to be somewhere around $4,000, $4,500 easily. And if your insurance is going to pay for a $4,000, $4,500 wheelchair, good luck with your premium next year, buddy, because that premium is going to skyrocket. I'm telling you now.
I think skyrocket is an understatement. Let's go Galaxy rocket.
Yeah.
Let's go Star Wars rocket.
Oh, absolutely.
I mean, at this point, we out of this world, right?
Absolutely.
Because the sky has
1,000%.
literally been, right, we have broken all of the barriers of planet Earth at that point, right? $4,000 for a wheelchair, that's insane. But not impossible, or not improbable at this point, right? It's something that could easily happen when you literally roll back the curtain and actually sit down and put pen to paper.
If I sprain my ankle, bro, let me get one of these office chairs. I'll bring it back.
You gonna bring it back? You're not gonna do the wheelchair?
Nah, man. They got wheels on this little office chair, and that's all I need. I'm gonna pull myself with the other foot. That's good. I'm not paying this for the wheelchair, man.
Not even a little bit, right? Where there's a wheel, there's a way. Right?
Absolutely.
There you go. So I think that hopefully explains it in a concrete example. And that's not even getting into things like medications where APIs are involved, also known as active pharmaceutical ingredients, which is basically saying, what is the active ingredient in Advil? Ibuprofen. So at that point, if ibuprofen across the globe that's being manufactured in a different country is marked up, your Advil now gets marked up. Your cholesterol medication, your insulin, all of those things are APIs, active ingredients.
Yep.
And if they're actively being marked up, you're going to actively pay more. So that's just an example, but we wanted to do the wheelchair because I think it's easier for people to wrap their head around, because it's not something that they feel is easily made and manufactured somewhere that they know. They just know that they get them, they use them, and somebody paid for them.
And same thing with blood pressure machines, glucometers, all this good stuff. And then something that you haven't really considered, you know, let's say you buy one of these things and it comes with batteries. You might be paying a tariff on the battery that came with it.
Yes.
from a different country than you paying the tariff from the actual machine.
For the device itself. Yep. So you got two different tariffs, two different things, and it's all hitting your pockets. And I think, again, the part that's really upsetting for people is that they never thought about this. They thought it was only on certain things. And look, I don't have to buy this. I ain't buying a car no time soon. It ain't my problem. I'm not buying a phone no time soon.
Yeah.
I'm not buying fill in the blank anytime soon, so it ain't my problem. But are you going to get a syringe? a bottle of medication? Are you going to get gauze? Are you going to get bandages? Are you going to get all of the things that you use or your family member uses on a daily, if not weekly basis, or monthly basis? Your cost is going up too.
Absolutely.
And you may not think it is, but newsflash, we broke the news at Byja Radio that your cost is going up just like everybody else's. However, one thing I'm happy to say, and Patient Zero pointed this out when we were looking at what we're going to talk about besides cost going up. He said, well, Dr. Jasper, how is it that your costs are going to, in essence, not go up to where it's going to be a negative thing for your patients? And I said, aha.
Yep.
I went old school, coming to America. Aha. Aha. I went coming to America.
Just taste the soup.
I'll taste the soup. Where's the spoon? Okay, that's my that's my bad Eddie Murphy / Arsenio Hall impression. However,
you know what? There's a few hills I'm willing to die on, and one of the hills is that Coming to America is the greatest movie ever.
I'm not going to argue with you with that.
If I ask you how many times have you seen Coming to America, and you can answer with a finite number, you failed at life.
There you go.
The real answer is I don't know, because you should have seen it so many times
that you know all of the actual
that you know all of the words and
the scenes
and all the scenes, and that you have no clue how many times you've seen it.
That's right.
That sometimes I will watch the cursing version and then follow it with the edited version on TNT, just because I like to laugh at the ridiculousness that they edited with.
I can see that.
And look, I'm gonna just say this, and then we can get back to the podcast. But like, when Samuel L. Jackson busts into McDowell's and Akeem is like confronting him.
Yes.
And he's like, who the hell is this airhead? Yeah. And I'm like, bro, nobody would actually say that in life.
Yeah, I could see that.
But it's hilarious.
Especially Samuel L. Jackson. I'm pretty sure
I want,
out of all the words in his vocabulary that I would see on all movies, it would never be airhead.
I think Samuel L. Jackson has clauses in his contract where it raises the price of what he gets paid every time he uses the MF word.
Yeah,
I promise.
Yeah,
there has to be like some type of incentive.
It's like him and Michael Buffer with "Let's Get Ready to Rumble."
Exactly, it's like his catchphrase.
I get it.
Like he invented it.
I support it, and I will say that is actually a great clause if he does have that.
Oh, bro,
because he can deliver. He can deliver an F-bomb or MF bomb and all of that like no other. I mean, Pulp Fiction, solid gold. I mean, at the end of the day, I think, that's one of the things I remember most. Same goes for Coming to America. However, I will say, I do believe Eddie Murphy probably has slept on more than a lot in that actual movie, all the people he played.
Oh, 1,000%.
Right. I just don't think anybody realizes. And also, people don't realize that the guy's kind of a musical genius. Like, wrote a lot of music.
Likes to
party all the time. But apparently he actually can play the piano like classically, and most people don't know that. Like, insanely good. Just talented, right? Yeah. It's just one of those things that people just remember you only for one thing. However, they won't only remember us for just being amazing radio show hosts. They'll remember that we're actually bringing information to them in a very high level fashion. So circling back to the episode, I think one of the things that we were alluding to was that Patient Zero asked me, how do we actually keep our costs down for patients like himself, considering tariffs and the way that things are going? And one of the things I actually pointed out to him with my Eddie Murphy aha moment was that we actually have one of the benefits that a lot of people don't have. Number one, we know how much things cost up front. Yep. And number two, we don't have 14, 15, 10, 12, 6, however many people within the actual equation of doctor-patient. As much as most people think it's a doctor-patient relationship in the traditional healthcare industry, it's not. You're literally dealing with, hey, I want to get my prescription. However, I now have to worry about the insurance, the pharmacy benefit manager, or the PBM. On top of the PBM, you're talking about the authorization department. On top of the authorization department, you're talking about sometimes an appeals department. Then that's also including the pharmacy, the pharmacist, the pharmacy tech. And then we're not even getting into the manufacturers and everything else that makes the medicine. So you're having all those people in the equation, whereas with us, it's us and the patient. So when it happens, we are able to have an increase, but the increase is far lower than anybody else because we don't have to mark things up as much to cover and pay as many people in the
Facts.
equation.
Yep.
It really comes down to doctor patient. And those examples happen all the time. When it comes to medications, we're able to literally get the medicine, tell the patients how much it costs, give the patient the medicine, and that's it. There isn't all of the extra stuff that comes in and goes into effect with that. So I know Patient Zero, you've seen us do this. I think you have said on multiple conversations and even on multiple episodes that we have done this for you. Would you think it's fair to say that not a lot of people are doing that when it comes to healthcare, considering what's going on with tariffs and everything else? You think they're going to be able to tell people how much stuff costs up front? And if so, where would that be?
Well, first of all, I don't think it'll be really accurate to tell right now because, like you said, too many hands in the pot, and also each hand is looking at an increase. So that's almost mathematically impossible at this point in time, right? But also, you gotta take into consideration, this. A lot of things that I've done through the clinic in terms of labs and prescriptions and things like that were just cheaper than the price that I would have had to pay with my insurance. So when the price is already lower, then there's going to be less of an increase. So it's a lot of things to consider. And look, I've always said the same thing. I'm not anti-insurance. I'm just telling you to crunch the numbers and do your homework. And when it comes to this tariff example, because there's a lot of different hands and there's a lot of different moving parts and there's a lot of different pieces and there's a lot of different ways and a lot of different things adding to the cost and contributing to that cost, you're going to see more of a cost increase than something that's just billed to you directly.
Correct. And I think the other part people can wrap their head around is that you, as a consumer or as a patient or a client, whatever the term is, if you're literally working with someone and they have 14 people they have to pay, their numbers are going to be a lot different when they only have to pay 2 or 1 or
True.
Something in a lower fashion. And at our practice, we're not having these crazy amounts of staff members that are going to make our overhead costs go through the roof. We're only paying the people that absolutely are necessary. And when that happens, that allows us to keep our costs low. And if our costs are low, we don't have to mark things up as much. And that's something that a lot of people will potentially understand.
Right.
If I'm not having to pay 7 people, then I don't have to mark up things to cover 7 people.
Right.
At that point, you, a client, a patient, a member, all of the terms we use when it comes to people who sign up with us, and also people who are in DPC spaces, they literally have less cost. And if I'm able to have less cost, you are likely going to have less cost.
So real life example. There's been times I've come to the clinic. I come to the clinic. I have my normal visit. I'll have some labs. So I'll get some blood drawn at the clinic. I'll do a urine sample at the clinic. And then I can pick up a prescription at the clinic. All these things have been done at Byja Clinic. Mm-hmm. Whereas if you think about it, you go somewhere else, you go down the street, right? And to whatever, Dr. Johnson, you go see Dr. Johnson. Dr. Johnson has somebody at the front desk. He has a whole bunch of people in the same building. He has a nurse that comes out. He has to see you. Then he sends you to LabCorp, which is or what's the other one? LabCorp and Quest and all these other different places that are in different facilities that have a bunch of people there for you to get tested. And then you got to go around the corner to a Vita or CVS or Walgreens or whatever pharmacy of your choice that has a different facility and a ton of people there. Mm-hmm. So, obviously costs are going to be up. So for somebody like me who's fortunate to be a part of this fantastic clinic, I can not only did I not have to burn my gas and go all over Baton Rouge, I only had to pay one facility and to do all these different services. So
that one-stop shop
Saves you money.
Saves you money, but it also saves you a lot of time and also a lot of effort, right?
Correct.
Because let's assume all of these places were within the same complex, right? They shared a parking lot. Let's just make it easy. Let's assume all of these places. You still have to talk about 4 different systems, right?
At least
5 different systems. And then 4 different encounters with 4 different customer service representatives, front desk people, medical staff, whatever the term is. And all of those things increase in efficiency because now you have to walk out of one to go to the other and then go from the other to the next. And that's where healthcare costs go through the roof. It literally goes up because you have so many people in these different setups that you have no communication from one to the other. And all that turns into is more cost. And now we're adding more cost on top of the exorbitant costs that have already been there. We already know the healthcare costs are exponential. We know that. We've done episode after episode after episode on how much things cost in America when it comes to healthcare. Now we're adding more cost on top of the exorbitant cost already. It's just crazy
it's just a problem.
what we're going through. And the worst part is most people don't even say, you know what, healthcare is already expensive. This must make it more. No, most people are like, well, I don't really think it's going to get any worse. Buckle up.
Right.
That's all
Get
I can
ready.
say.
And look, one thing about me and something that you didn't mention, one of my pet peeves is I like to pay for something and be done with it.
Correct.
That's my thing. I love paying for things and being done with it. Right. So what happened is because we're going through all this unsure times, and I'm not downing anybody, but this is something that's inevitable, right? You might go to the doctor, you pay your copay if you got a copay, or you pay an estimate of what they think you'll owe, and you may get a bill later. Then you go get your labs, and then you go do the same thing, and now you got to pay again, and then you might get a bill later. And then I'm pretty sure at the pharmacy, you probably won't get a bill later, but who knows what that's going to cost, and then you got to pay again. When I come here, I don't even take my debit card out or my credit card out. You go let me know, well, Dr. Jasper, you will let me know how much things going to cost. That's going to be drawn out from my method of payment on file, and I go by my merry way. And I don't see another bill from the same transaction 2-3 months down the road.
Let me do one more thing to show kind of the people we are. And this is how I operate because I love to, in essence, make sure I am doing what I say I'm going to do. I'm a man of really and truthfully, if you say you're going to do something, you do it. There aren't any excuses that you need to actually give on that. So patient zero, I'm going to throw this back to you really quickly. There was a point in time where we were billing you on your membership every month. And you actually sent me a message and said, hey man, I think that I've been paying more. And in essence, we overcharged you. And I said, thank you for letting me know. Can you let the people know what did I say we were going to do at that point once I realized the mistake and you pointed it out to me?
Yeah. You retroactively recalculated how much I was paying over, and then you put that credit on my account.
And that was it.
And that was it.
That was
so,
it.
So I didn't have a membership fee for like a month or two.
Right.
And I was good.
And it wasn't that complicated. It was, I apologize. I didn't realize that we had you on a higher bill than what you previously were. I said, I did the math. This is how much we owe you. I'm going to put the credit on. So for the next several months, that credit is applied. And if you don't have a bill, you don't have a bill. And you were like, okay. Like most people don't do that. They would say, yeah, look, this is a mistake. We made the mistake, but let's go ahead and try to find a way to make sure that even though we made the mistake, you still somehow owe something.
Well, let's talk about the fact that the reason why you were able to calculate the mistake is because everything is done through you. Somebody else makes a mistake, you have to confer with 7, 8, 9, 10 other people because there's all kind of hands in the pot. And when we get away from simplicity, things normally go left. It's just natural, It's kind of like, I know this is a poor example, but whatever. It's like telling us, you ever do that exercise where you tell one person something and then they pass it down.
Telephone.
And until that's what it's called, telephone?
Telephone, yeah.
And then when it gets to the last person and they repeat what they heard, is a completely different story than what it started as. You know what I mean? Like when you have all these different people working with hands in the same pot, things get messed up rather easily.
Yep, agreed. And that's the part where direct primary care makes the biggest difference. People can't understand it until they see it. And they also can't understand it until they start doing numbers. And when we have the numbers paired by the traditional insurance model, we win every time. The numbers of amount of time spent with us trying to correct or clarify or explain, we usually spend more time there, but it saves you time on the back end. We had a patient come and see me yesterday who literally said it's an unmatched experience that he had where he signed up with us. And the day that he signed up with us, he's literally had more communication and learned more from us in 2 visits than he's had in all 40-something years of his life. That should tell you something is different over here. And that's also saying, in so many words, when it comes to all of those things that you're hearing me talk about, your syringes, your gloves, your pill boxes, your blood pressure cuffs, your, what other things do we talk about? Your blood pressure monitors, your pulse oximeters, your glucose meters, all of that. Those things are cheaper here.
Yep.
Because I am able to get them at a price that literally is wholesale. When it's wholesale, I then may have a little bit of an added cost, but since I've already gotten a huge discount, I'm more than likely going to pass it on to our patients. And why? Because I don't have to mark it up. I don't have to do what everybody else does because that's not our model. My goal is to take care of people because that's what I went to medical school for. It wasn't to literally work for insurance companies. So if I work for myself and therefore work for patients, they get the benefit. And when they get the benefit, they stay. And that's why Patient Zero is sitting in the co-host seat. That's why Patient Zero is advocating for you to crunch the numbers. That's why he's telling you that insurance is not a bad thing. It's just knowing how to use it. And when you learn how to do that, everything gets better. Yep. And I believe everybody will see that if they give us that opportunity. But even if you don't give us the opportunity, if you give a DPC doctor the opportunity, you'll be pleasantly surprised. So I think we've done a good job, man. I think we can pat ourselves on the back. I think a lot of people will potentially say, you know what, I never even thought about it like that. And some of our dedicated listeners, Brother Antonio, which I know he usually listens in, I'm sure he's going to crunch the numbers and realize about these gauze and these blood pressure cuffs and all of these things that could be potentially going up. It's one of those things where if he has an aha moment and many other people have an aha moment, we did our job, man. And I feel like sitting in this media chair, people don't realize that this is work, but more importantly, it's helping people.
Yeah.
I actually talked to my line brother last week. And when I talked to him, he said, man, I didn't realize you're putting out a show almost every week, if not every week. And I say, yeah, man, we sit in the chair, we take it seriously, we find a topic, and we want to go ahead and give it a chance to really be discussed so people learn. And he said, man, that's actually pretty cool because a lot of people don't do that. A lot of people don't take things like healthcare that seriously, but you all are doing good work and I appreciate it. So we appreciate you for listening and we appreciate you for subscribing, liking, sharing, and more importantly, following. To the point where you say, you know what, I'm going to take these episodes and I'm going to do what I need to do, not only to listen and subscribe, but follow like, hey, I'm going to put these plans into action. I'm going to get into care. I'm going to engage in care. I'm going to look at my numbers. I'm going to do the things that are meant to be done from the things they're giving suggestions about so I can live a longer, healthier, and happier life. So I think that's it. So Patient Zero, anything else you want to give the people? If not, well, let's do it this way. How about you give us any closing thoughts about today's episode? And then once you're done with the closing thoughts, I'll go ahead and say, where are the people able to find you? And then I'll go ahead and do the same.
Yeah. So I'll say this. Give Dr. Jasper a free consultation. You know, just give him that opportunity and crunch the numbers and make things work for you because, you know, it's always been important. You know, I'm one of the people where I lowered my premiums on my insurance in exchange for a higher deductible, and I don't really use my insurance like that, so it worked for me financially, and I pay my membership fees, and I don't really see a difference in cost. I just get better care, so that's something that I would encourage you to take a look at. It may not work for everybody, but at least look at it. Number one. Number two. That's been my ask since we started this radio show. But also, man, in these economic times, you have to be more conservative than you've been in the past with your finances. And part of looking at your spending is seeing what you pay for, healthcare and other services that you may utilize. Take a look at all that and take all these things into consideration, because being conservative may be the difference, or maybe the help that you need to make it in these times.
I appreciate that, brother. Now, let me go ahead and do quick closing thoughts. First and foremost, tariffs are here. And maybe at the time you're listening to this, they have left. Maybe not. But if they are here, I think the main thing you need to realize is that they are going to impact you in some way, shape, or form. You may not think they're going to impact you at all. You may have no idea that they're coming. Not sure how that is, but hey, nevertheless, if you don't have any idea, hopefully you do now. But hopefully you'll say, hey, now that I know that the price increase is coming, I've taken steps to figure out ways to avoid that. Direct primary care is one of those ways. No way, shape, or form of people really and truthfully saying to us that we don't stack up against something other than you saying this is what I'm used to and this is what I want to do because I think it makes more sense for me. Otherwise, if you say we're going to literally stack up direct primary care next to somebody else in those other industries, we win every time because we give great care. We do it at an affordable rate. We do it in a transparent manner, and we make it efficient and understandable for anybody who comes through the door. It's not just those that have the quote unquote good insurance. It's not just for those that have more means. Everybody gets it. And at this point, we are really and truthfully confident in saying, if you give the direct primary care field, not just Dr. Jasper, people across the board, an opportunity, I guarantee you'll be surprised at how much savings you have, how much your experience is different, and more importantly, how we are blazing the trail. So much so that I've had group chats where people will send me messages and others are in the group chat and says, Dr. Jasper has us spoiled. I'm at a different doctor's office and they had me waiting for X amount of time. And when we go to his office and we never wait, we forgot what that felt like. So that tells me we're doing something right. And that's not getting into medication costs, lab costs, and then the ease of communication, all the things that we do. So if you haven't considered DPC, do it. It doesn't cost anything over here. You get 30 minutes to sit down and talk with us to see if it's a good fit. If not, you can go back and do what you're doing. But otherwise, if the tariffs are coming and your cost is going up, you may want to do something different. With that, brother, patient zero, where can the people find you outside of this medium? And then I'll close out with a special announcement, and then we'll go ahead and let the people know where we'll be for our next episode.
Yep, they can find me at George_Becnel on X, at Becnel Media on Instagram, and George Becnel II on LinkedIn.
All right. And for us, you can find us at our website, www.byja.org, byja.org. You can do our nonprofit website to help support us doing direct primary care for those in need at www.byjaca.org for Byja Charitable Alliance. We're on Instagram and on Facebook at Byja Clinic, all one word. And we're also on LinkedIn under Byja Clinic. And a special announcement, Brother Patient Zero is not actually wanting to say anything, but I, sometimes got to give this man his flowers while we are here. Brother Patient Zero is working on producing a second show under the Byja Radio Network, and we're working on that to figure out what that's going to look like. He is putting it together. He is doing it under the Becnel Media platform, and he will be bringing it forth. So there will be a second show, not a Byja Radio show, but a second show coming out under this umbrella. And we are looking forward to it. So I'm just letting you know it's a sneak peek. If you are on this episode, and I believe we're at episode 25, if I remember correctly.
Correct.
Episode 25. If you've made it to 25 episodes, you get the sneak peek. So at this point, I hope that you all are going to keep sitting in that passenger seat with us, taking this ride, because we got more in store for you. And based off of that, that should hopefully tell you, stay tuned for the next episode. So we will see you when we see you. And thank you for listening in.